This is The Importance of the QT Interval by Kate Rice from Maryville University. So the committee members include the chair, which is Dr. Rita Wunderlich, and here are her credentials, and she is an associate professor at Catherine McAuley School of Nursing. The other committee member is the clinical educator on the floor that this project will take place on, and she is Janice Hutchison, and these are her credentials as well. So to start, healthcare providers need to diagnose and treat their patients. That is part of healthcare. The treatment needs to be safe, and the correct method of treatment for each patient needs to be used, which is why there's such an emphasis on patient-specific care. Some aspects of the patient can be overlooked, such as the QT interval. The QT interval can be a predictor of sudden cardiac death in the form of a fatal arrhythmia, and this was described by Leon. A common arrhythmia that occurs as a result of a prolonged QT interval is polymorphic ventricular tachycardia. And when polymorphic ventricular tachycardia, or polymorphic VTach, is prolonged, then it is called torsades de pointes, which is another fact that Leon describes. The purpose of this quality improvement project is to determine if an educational intervention will increase the awareness of medications and factors that are known to prolong a patient's QT interval. So the aim of this project is to increase awareness of the negative impact that a prolonged QT interval has on patient outcomes, improve patient safety, and increase nurses' knowledge of the QT interval. The PICO question that is associated with this project asks, do nurses report their patients' prolonged QT intervals to the patient's providers? So this project simply asks if nurses are or are not reporting a finding of a prolonged QT interval to the provider. Once they report it, that's up to the provider to make a judgment call on whether an alteration in the treatment plan needs to be made. Many providers and nurses realize that certain medications and treatments can prolong the QT interval. Tisdale explains that medications such as certain antipsychotics, antiarrhythmics, antibiotics, antidepressants, and several others can prolong the QT interval. This is not news to anyone, but steps need to be taken. Of course, not every single patient that receives these types of medications will experience a prolonged QT interval. Only some will, but because this is a high-stakes, low-occurrence project with the end goal of educating nurses so that adverse events can be prevented. If the QT interval becomes too prolonged, then it can be extremely dangerous. Even if it's for just one person, one life matters. Many patients with a prolonged QT interval are given medications that can prolong the QT interval even more. And this was found by Tisdale. The benefit may outweigh the risk, or the provider may be unaware of the current QT interval, and they would maybe alter the plan of care if they knew that the QT interval was prolonged. Sometimes they just don't realize it. Torsades de pointes is rather rare, but when it does happen, it often occurs in critically ill patients with a prolonged QT interval, and often occurs in the ICU setting as well. And these researchers here found that to be true. These patients are often given a combination of several different medications that can prolong the QT interval. Medications that can prolong the QT interval should be prescribed more judiciously in this patient population because they're already at such risk of experiencing a cardiovascular death. Sarah and other researchers explain that patients with chest pain could have a prolonged QT interval, and this QT interval is more prolonged if they experience transmural ischemia. These patients are often prescribed cardiac medications that affect the QT interval, such as certain common antiarrhythmics. These patients could experience sudden cardiac death, but could also suffer from an MI in an already brittle body, which is again why it's so important to monitor the QT interval. This project affects nurses as well as patients, since the nurses on the floor that this project will be conducted on will be invited to an educational meeting regarding the importance of the QT interval. Patients need not just kind nurses, but knowledgeable and educated nurses as well, in order to properly care for them. For this reason, the meeting will teach nurses what the QT interval is, what it does, why it is important, and why it must be taken into consideration when certain medications are prescribed. So the significance of this is, in part, with ethics, because ethics is a part of basic nursing, and it might be uncomfortable for a nurse to question a physician's order for a medication that the nurse now knows can prolong the QT interval, but if a nurse is always advocating for his or her patient, then this discomfort is necessary. It can be very uncomfortable, and sometimes the physician feels like they're being attacked if you question their order, but it's part of being a nurse. When a nurse accepts the responsibility of providing patient care, the nurse is saying that he or she is willing to go the extra mile to ensure that no harm comes to any of their patients. So this could mean looking up their patient's QT interval on their admission EKG and then comparing it with a more recent EKG, or telling the provider, this is the current QT interval, would it be possible to prescribe an alternative medication, for instance, Compazine instead of Zofran, since Zofran has a more significant impact on the QT interval than Compazine does. Compazine does still prolong the QT interval some, but not as significantly as Zofran, which is why we still want to treat the problem, but decrease the chance of prolonging the QT interval too much. Healthcare is a business, but it's a business in which people's lives are at stake. Though no one intentionally prescribes harmful treatment, patients can in fact be harmed by treatments that are prescribed with good intentions, and this was found by Leslie and other researchers. Patients can die as a result of mistakes, poor quality of care, and ignorance of treatment options. Thankfully, Mercy Hospital supports its employees in their educational endeavors. They encourage staff to advance their education by obtaining bachelor's degrees, master's degrees, and so on. My manager and clinical educator support this project and have agreed to help as need be, so I'm very lucky that they've agreed to help so much. Nurses in this practice setting will be more educated on the impact that the QT interval has on patient care. Patients will have safer outcomes, and providers will know that the nurses caring for their patients are ever mindful of multiple aspects of patient care. So all of these are significant benefits to practice. Nurses are not necessarily the ones who should be watching the QT interval and paying close attention to all the medications that are known to prolong the QT interval, but it is something that they can do. If they're knowledgeable about it, then this is something they can do for their patients. This project improves nurses' clinical practice and knowledge so that the patients, nurses, and providers all quote-unquote win, so everyone benefits here. There are three main themes in this literature review. They are medications that are known to prolong the QT interval, patient comorbidities, and the reason that they are admitted on an inpatient basis, and the outcome of patients who experience a prolonged QT interval, as well as a discussion of possible solutions for these patients. So first, medications. And medications that prolong the QT interval are frequently given to patients who already have a prolonged QT interval. Tisdale and other researchers found that 87 of 251 patients who were admitted with a prolonged QT interval were given medications that can also prolong the QT interval. And then they found that 70 of the 166 patients who had a QT interval greater than 500 milliseconds were given additional QT prolonging medications, so that 57.1% of these patients experienced a further elongation in their QT interval. This is extremely significant because that means that over half of these patients had a further elongation in their QT interval, and that's extremely dangerous. So many people did respond negatively, and this puts them at risk. So first we need to talk about interpreting an EKG. There are 4 different algorithms used to interpret and measure out an EKG. A difference in the QT interval is more clinically significant and important than a computerized reading, and Gleifield and other researchers found this to be true. So if some sort of alert system was used in one organization, then only one algorithm needs to be used within that same organization, so that way everything is the same. Because maybe one cardiologist might prefer to interpret an EKG with one method, but an electrophysiologist within the same organization might have been trained to use another, so then there will be some discrepancies between the EKGs, so they need to all use the same method for congruency of care. The second theme is comorbidities and risk factors. So Sarah and other researchers found that a patient with CAD or coronary artery disease often presents with a prolonged QT interval as a result of coronary microvascular dysfunction, which is CMD, and ischemia, which can prolong the QT interval. These same researchers found that when these patients are given adenosine, they were more likely to experience an even more prolonged QT interval. So these patients certainly required adenosine. They weren't being given adenosine for no reason, but the provider could ask if the benefit outweighs the risk, or if there's maybe another similar treatment option that could be used first instead. And then if that doesn't work, then they can go to adenosine with those specific patients that have a prolonged QT interval. Another option is that these patients could still receive adenosine, and then the provider could instruct the nurses to watch these patients more closely and then report a prolonged QT interval to the provider if it does happen. So there are several methods of avoiding a prolonged QT interval. Bonukdar and other researchers found that patients with type 2 diabetes present with a higher QTc than similar patients who do not have type 2 diabetes. So not all patients who have type 2 diabetes are going to have a prolonged QT interval, but because they're more predisposed to it, medications that are known to prolong the QT interval should be prescribed to them more rarely and more carefully. It might be that the benefit outweighs the risk and they need this medication, but if it's possible to prescribe another similar one, then maybe the provider needs to do that instead. So this project is not trying to just do away with all medications that can prolong the QT interval, but to instead choose the best medication for that specific patient and attempt to avoid a negative outcome. The third theme is patient outcomes, and this examines the patient's outcome after the administration of multiple medications that are known to prolong the QT interval. This also examines the possible solutions that can be put into place to enhance patient safety. Because as I mentioned, so, they might need that medication, but maybe they don't. Maybe they can do a different treatment option. Nielsen and other researchers found that cardiovascular death increased when patients experienced a prolonged QT interval, regardless of age, sex, and presence of cardiovascular disease. These researchers examined the research further and found that men who had a prolonged QT interval were more likely to experience cardiovascular death than women with a prolonged QT interval, but women with a very short QT interval were more likely than men to die from cardiovascular-related death. So either way, the QT interval is very important and significant to care, so it needs to be watched. And some may ask why certain patients will experience torsades de pointes or another arrhythmia, while other similar patients do not experience this. So Tisdale explained that medications that prolong the QT interval will have much to do with the incidence of potentially fatal arrhythmias, but there are a lot of other factors like gender, age, hypomagnesemia, hypokalemia, sepsis, acute MI, heart failure with reduced ejection fraction, and many more can all lead to torsades. So a QT alert system could be used that would alert a provider if a patient is nearing the quote-unquote limit or is experiencing a prolonged QT interval. So some researchers studied the effect of a QT alert system and found that it sent out an alert for patients who had a QT interval greater than 500 milliseconds. So if someone was to be using an alert system, it would allow providers to watch patients' QT intervals more closely. They could change the treatment plan if need be, and it could prevent the incidence of dangerous arrhythmias. Because this could prevent it, there's no way to really measure that because the adverse arrhythmia did not ever happen. But because we know what could happen, it's better to attempt to prevent it and just avoid that at all cost. The concepts and definitions that are associated with this project are vigilance and education, and they're key concepts in this project because this project asks if, after an educational meeting, nurses will then report prolonged QT intervals to their patients' physicians. Vigilantia means to be watchful, at attention, and awake, per Douglas Harper, and Zinkan et al. Find that it is a time in which an individual is alert and watchful, especially in times of danger. So this would apply to avoiding fatal arrhythmia. Because of their close proximity to patients, nurses are able to monitor patients more closely than others might be able to. So they need to be vigilant about assessing patients competently, assessing patient progress, noticing problems in the early stages, and correctly deciding on how they're going to resolve these problems. This is per Geyer. Providers need to be vigilant about prescribing a proper and safe treatment. It needs to be patient-specific. Nurses need to be vigilant about watching their patients and speaking up if they notice that their patients are at risk of developing a prolonged QT interval as a result of being prescribed multiple medications known to prolong the QT interval. This is why education comes into play, because now the nurses are more educated and know the impact of the QT interval. Education is defined as a process of experience, interaction, a work in progress, and is a learning process used to gain knowledge and understanding of a specific topic, per Blogspot. Jackson, Jousey, and Honey explain that an in-service technique can benefit an organization because it is a less expensive way to educate a large group of people in a short amount of time. not all nurses or staff are receptive to education, no matter which format it's delivered in. And Bowen, Rotz, Patterson, and Sen found that a survey of nurses' attitude on patient medication education showed that nurses are often agreeable to the idea of education on medication, but when it comes time to receive the education, they are not as receptive as they stated they once were. The theoretical framework associated with this project is Ida Jean Orlando's deliberative nursing process theory, and this is designed so that nursing staff can create a care plan that can change depending on various factors, especially if complex factors come into play, per Gonzalo. Ida Jean Orlando believed that nursing action should be fueled by the relationship that exists between the patient and the nurse, not merely by physician orders. It's basic nursing theory that just because a physician tells you to do something doesn't mean the nurse has to follow that order. They're allowed to question the physician. For this reason, it is a nurse's responsibility to advocate for their patients. A patient cannot tell a physician, "Oh, I feel as though my QTC is prolonged and I may be in danger," but a nurse can report a prolonged QT interval to the provider. After that, it's up to the provider if they want to change the medication, continue it but monitor, or do some other alteration of care. This theory pertains to this project because it explains that the purpose of nursing is helping the patient, even though it might be difficult. Because it is difficult to speak to a physician and say, "Are you sure you want to do that?" Without, you still want to sound professional, but protect the patient. So in regards to methodology, the data for this project was collected using a retrospective survey review, and approximately 50 surveys were collected. This is a quantitative exploratory design method, and the participants are the patients. They don't engage in this study, so no patient or staff identifiers will be used. As for the design, there's inclusion and exclusion criteria that is used in order to avoid inaccurate or skewed results. The inclusion criteria will only use data collected between July 1st and July 31st of 2020, and the patient data will be collected from inpatients on a postoperative cardiothoracic and vascular progressive care unit. The patients need to be between 18 and 89 years old. The exclusion criteria includes data collected outside of this July 1st through July 31st data range. And if a patient is less than 18 or older than 89, then he or she is not going to be used for this study. If the survey does not have a documentation of an observed prolonged QT interval, then of course no data will be used. They might be still using treatment options that could prolong the QT interval, but if it's not prolonged, then that would skew the results, so that will not be used. So to recruit the nurses for this, first an educational meeting will be held by the researcher, and this meeting will explain the reason for the surveys and then provide information regarding the inclusion and exclusion criteria. So after this meeting, the nurses can consent or refuse to take part in the study. They're just filling out the surveys is all they're doing. The survey includes documentation of observed patients' prolonged QT intervals and will include data points such as QT interval greater than 500 milliseconds, QT interval was reported to attending physician or cardiologist, patient was prescribed medications known to prolong the QT interval, patient's first recorded EKG had a prolonged QT interval, patient has experienced any arrhythmias during the hospitalization, and patient has comorbidities that can prolong the QT interval. Some of the interventions include physician-acknowledged current QT interval, and medications were reviewed by the physician. And those are all part of the data collection tool. As for reliability and validity, this data collection tool groups the information received from the surveys into nominal data, and then this data is used to make an informed statement regarding the incidence of nurses reporting patients' prolonged QT intervals to the provider. This then makes it easier to see that some patients might have multiple factors or take multiple medications that can prolong the QT interval, or have all of it. So that helps to see the reliability and validity of it. As for resources, the unit manager is essential to this project, as well as the core nursing staff who will be filling out the surveys. Patients are essential as well, considering their data is necessary in the data collection period. Money is necessary as well for the budget, and includes the research computer, the cost of printing the report, electricity, rent, fuel for travel, etc. So when calculated, the entire cost of this process is $15,200. And to protect the human subjects, no patient identifiers will be used, so there's no risk of breaching confidentiality. there are no risks associated with monitoring these patients more closely. If anything, the patients, because they're monitored more closely, there's less risk of anything adverse happening. The surveys will be kept in the nurse manager's locked office during the data collection period, so that way the human subjects are protected. And then the surveys will be kept in the researcher's locked home office during the analysis portion of this project. And when the study is completed, then these surveys will be destroyed in order to protect all patient and staff data. The software that is going to be used for this project is called Excel PHStat. The research statement essentially explains that this quality improvement project aims to increase provider notification of prolonged QT intervals in an attempt to enhance patient safety. So this program will then measure the hypothesis, which asks if provider notification occurred or not. Provider notification is measured by finding if provider notification did in fact occur, which is the ultimate goal. The rate of notification will be measured after an educational meeting in order to accurately state whether the providers were notified. Excel PHStat will then be used in order to run a z-test for the difference of two proportions in order to compare two independent sample proportions. These are the references that were used during this project. And thank you so much for your time.